Let them evolve based on what's going on in their life so that they can create a situation in which they can win.
I love giving choices. I don't like saying it's my way or the highway, unless this is all we have, and that's going to keep them alive and healthy.
Really encourage them to experiment with, for me, it would be new foods, meal plans, to do things the way they choose a meal when they go out to eat, if they're prepping meals for the week. Just allow them to experiment.
Hello, everybody. The title of today's podcast is Let Them Stay Sick, Why Most People Won't Change Until It's Too Late. It's a great topic that we're talking about today because it's something that you introduced me to, and now I do it every day in my practice, and I know you do it every day in yours. Folks out there, everybody has tried to get their significant other to lose weight, to exercise, to take their medications, to go to the doctor. Everybody's tried to tell their best friends to quit smoking. How's that working out?
Not so successful.
It doesn't work out so well. So the truth is that most people won't change until something awful happens. That's the problem. And a heart attack, a stroke, kidney failure, any bad diagnosis that happens. And even then, and a patient told me this today, even then, they still might not.
Yeah, they may not.
So the science backs this up. But today we want to challenge why most people won't change until there's a crisis by using the let them theory, made famous by everybody's #1 podcast,
Mel Robbins.
Mel Robbins. And as I said, you introduced me to this, and it certainly got me going in the direction that I am now, both personally and professionally. So what's your version of what the let them theory is in general? Not to how you apply, but what do you feel about it?
Let them, to me, is really just allowing someone to be in control of their health, their mind, their body, whatever it is that's going on for them at their own pace when they're ready to do so.
Yeah.
And you, as the observer, the friend, the spouse, whatever, allowing them to do that, relinquishing that control or worry. Well, you don't always relinquish the worry, but just relinquishing your role in getting them to take action, or to make a change, or
it's almost a fight for control, right?
It really is.
And it's like their opinions and their actions and their choices, but instead of basically, forcing somebody to behave how you wish,
which doesn't really work,
you step back and you let them. So that is Mel's theory, and it works. It protects somebody's peace, your peace. It protects. It allows you to see more clearly and choose how you respond.
And allows you to be in the moment.
It allows you to be in that moment.
If you're so consumed with trying to get someone to change, you're missing out on what's going on together, right? Between the two of you, around you, and what's going on for them too. You lose sight of that because you're so focused on trying to get them to whatever, get them to lose weight, get them to stop smoking, get them to listen, whatever that may be.
So, as I said, we're now using this in our practices, and if you please stay tuned, because when we go into our Get to Work section, Phil's going to talk about how it works in her nutrition practice, and I'm going to talk about how it works in my cardiac practice, and how all doctors, I think, should practice, healthcare professionals practice at this point. But how does it apply globally to healthcare? Well, imagine somebody has diabetes and heart disease, and you want them to exercise, and you want them to eat right, and you want them to lose weight, all the things that they're supposed to do, but they won't change. So you need to let them, right?
Yes.
Now, you can yell, you can beg, you can try to throw out the bad food in the house, you can throw out the cigarettes, you can drag them.
I've had clients do that, in the night they get up and they throw out all the snacks of their spouse. It doesn't really work well in the morning, by the way, but really take control. I'm sorry to interrupt you, but that happens. That really does happen.
Yeah, you can't force somebody to go to the gym. You can't force somebody to take their medications. And in the end, everybody's mad and nothing has changed.
Yeah, absolutely.
Okay, then that's why Mel developed this theory in the first place. So trying to push someone to be healthy is like trying to push a rope. And it won't work unless the other person is pulling from the other side. That's a really good visual. Now, the science that she has talked about has been back in 1983. That's how she derived the let them theory, because there's stages of behavior that all of us have when we want to move through the steps of making a change. One is pre-contemplation, thinking about it, is contemplation, more thinking about it, then preparation to make the change, and then finally making the action, and then lastly, maintaining it, which going back to our previous podcast about your 30-day reboot. And once you do those 3 weeks, and I had to think about doing it. I had to
think about it,
and then I did the action. Well, but then I did the action, and now I'm in a maintenance, and it's 2.5 years. So it's a very good example of how the steps of behavioral that get you to make those changes. In 2017, people with heart attacks who joined cardiac rehab, for one example, were 40% more likely to make lasting lifestyle changes than those people. And believe me, you have no idea how many times. I just had one today. Will you do the cardiac rehab already? I'm thinking about it, right? Yeah. I'm pre-contemplating. Yeah. I'm contemplating. But proof that the people that do cardiac rehab live longer and live better.
And, what does that go back to? Think about like one of our first episodes, we talked about fear,
yeah,
right?
It's about that fear.
Thinking about it and thinking about it, it's really a fear.
Yeah.
And backing someone into the corner when they're
so
fearful of doing something, it just never works. It always backfires, right? So you have to let them go through that process.
They do. And then in 2022, they actually did a study on guilt-based approaches to diet and fitness, and they most often led to people relapsing. Yeah. So if you try to guilt and shame somebody into dieting, they relapse. And if you try to get them to exercise, they just stop exercising from that standpoint.
But they're not doing it for them, they're doing it for you.
They're doing it for you. And that's why you have to let them make that change. Yeah. Self-motivation, self-internal motivation, not external pressure, promotes lifelong health from that standpoint. And it's applied to healthcare, because that's what we're here to talk about. So we have to stop that control battle, right? We need to lower the "don't tell me what to do."
We've all heard that, right?
No, I'd never heard that. But because people just kind of need to be able to take their own initiative. They need to be able to have some control. We also need to help. In terms of healthcare, we need to get them, for you and for me, to improve disclosing. Yeah. Right? They have to tell. Right? They don't tell you everything. They don't tell me everything. They don't, when they're ready. When they're ready. But they hide their symptoms with me sometimes, and they don't talk about that they're still smoking, that they're still drinking. Yeah. It happens all the time. Right to segue to, we need to boost their follow-ups. We need to boost their return and their ability to take precautions. And at the end of the day, it's about co-ownership. And I think absolutely. And I think getting back to, when you're building rapport with a patient or a person, it doesn't have to be a patient, but we're talking about healthcare. That takes time. Yes. It is not a one-shot deal. I mean, sometimes you'll be lucky and get someone to walk into your office and there really is a click and they trust you immediately. But it is a give and take, and that for every person that takes a period of time, right? It could be 2 visits, it could be 10 visits. But as the practitioner, you really have to give them that time and give them that space to work through. That's it. Of course, making sure they're always safe. Can't push a rope until they're pulling it. You can't. But I think the key is making sure they're safe, right? Making sure that while they're doing this, thinking about it and procrastinating, that they're not harming themselves in any way. Right. But giving them the space to have that control. Yeah. And that's really hard sometimes because, Type A personalities sometimes feel that we know best, particularly in our field. And if you just do what I tell you, right, you'll get where I want you to be. But that just doesn't work, right? No, of course not. It doesn't. But over the years, I understand where you're coming from, because now I understand that that's love. I understand differently that. It's my love language, honey. But that's your love language. We discussed that. We had a joke between us the other day. Hers is way different than mine. It is. But so that kind of segues us, and we'll get to our Get to Work section. And please stay tuned after this message. Hey, it's Phil. Thanks for watching today's episode of Unfiltered. But before we go any further, I want to tell you a little bit about my book, Cracking the Food Code. If you're sick of diets that don't work, you can't get rid of your weight, bloated, etc., this is for you. I created this to teach you how to reset your metabolism, refuel your body with optimal nutrition, and rewire your brain. So what are you waiting for? Go to Amazon and get your copy today.
I think it's really important to know that, our job as health practitioners is not to control. It's to create space for our patients to bring about awareness and change on their own.
Well, let's get to work, okay?
How do we do that?
How do you do that in your practice? And I want to talk about how I think doctors should do that, or healthcare professionals should do that in theirs.
So,
how do dietitians do it?
Right. So I can speak for myself. So when we talked about this, like what do we do in our own practices, I applied it to how I coach and counsel my clients and patients through the reboot. Right, so that's the perspective I'm going to use, so it kind of makes a little bit more sense. So 10 nutrition coaching strategies. Let them choose their starting point. It increases their commitment, not mine, and the overwhelm. Sometimes a patient may sit in front of me, this is their diagnosis, this is their issue, and I think, okay, we need to start with blank, but that's not where they're willing to start. So I have to allow them to start where they are. Let them struggle without judgment, right? Meeting them with curiosity and not criticism, because criticism is not going to build rapport with my client. And I need them to feel safe, because for them, whatever that struggle is very real to them. To me, it may not feel like such a big deal, or to you when a patient calls you at 3 a.m. in panic and you're like, okay, this is not a big deal. But to them, it is.
It is.
So we really need to be a little more curious about what's driving that and not be judgmental. Let them decide how to track. So in my particular program, I love people to require a food journal, and whether we use a tracking device or an actual written journal. I do have a professional opinion one over the other, but I allow my patients to choose what works for them, because I need them to feel like, one, they're in control, and two, feel comfortable, right? I do have clients who sometimes are older, they're not computer savvy, they don't want to use a tracking mechanism, and yet then I had a 90-year-old woman who's got it on her, what do you call her, Apple Watch. So I mean, to each their own. Let them say not yet. If we are talking about giving up alcohol,
you have to be ready,
or smoking, and if they say not yet, I need to respect that space. I'm going to come back to it until we can get in a place where we're willing to move forward. But I have to give them that ability to do that.
You do.
Let them take credit. And to me, this is one of the most important things. Allow this could be your children, your spouse, your patient, to have wins. No matter how small, let them take credit for their win that day. So I ask my clients often to journal.
I like that.
And journal every day. I want them to write something they're grateful for, or they feel they've really succeeded. I always try to ask them, what did you do this week that made you proud? It's not about me. It's about them and where they feel they're succeeding. Let them experiment. Really encourage them to experiment with, for me, it would be new foods, meal plans, to do things the way they choose a meal when they go out to eat. If they're prepping meals for the week, just allow them to experiment. Even if it's something I don't necessarily feel is the most productive, I have to allow them to work through that on their own. Let them feel the difference. Don't tell them how they feel. Let them experience it, right? Quite often, and I have heard from a lot of practitioners, well, you don't feel well when you do that, right? Well, how do we know how they feel, right? We have to ask them, let them feel the difference.
Okay.
Let them redefine success, because my version of success may be very different of theirs. Expand those success metrics and allow, this fosters growth and mindset. And let them ask for help. Give them the space to come to me and ask for help, and really explain to them that asking for help is a skill. It is not a weakness. And that's, in my practice, really important, because people are coming very vulnerable in various situations. And finally, let them evolve. Let a client shift their goals and their focus. If they're having a really crappy week and all they can do really and truly is not drink 5 diet sodas today and just one, let them. Just let them evolve based on what's going on in their life, so that they can create a situation in which they can win. And ultimately, at the end of the day, the win for me is the improvement in their health.
I think they're great. And I think that should be applied in all practice, in not just nutrition, but in medicine. My perspective is actually using the letters, let them, and I'll throw it up on the screen, and we'll throw up yours as well, so that they can actually look at that as well. So the first L is listen, okay, and that's for the patient to listen to the person that they're with. But also for us to listen to you. We have to listen. We have to listen to each other. The E is for empathy, because there's not enough. And now in the fast-paced world of seeing, maybe 5, 10, 15-minute visits, you're not really getting that empathy. There has to be empathy. There has to be empathy on our side to you to be able to really make the connection, because you can't get things started and get people to make changes for themselves until there's empathy. T for tell your concerns. You should be able to honestly, open. We talked about disclosing. You need to be able to feel comfortable telling your concerns, and you won't be judged, and you won't be ridiculed, and you'll be listened to. That goes back to listening. The other T is 2 safe choices. I try always to give choices and say, if there's a possibility, look, you got to take a blood thinner, you got to take a blood thinner. My patient asked me today, when can I come off with this one? Not yet. I want to come off now. No, you can't. But in a month, yes, you can. And here's a choice. It's just an example. When I prescribe cholesterol medications, I love giving choices. I don't like saying it's my way or the highway, unless this is all we have, and that's going to keep them alive and healthy and happy. H is for highlighting trade-offs, because again, it's saying, well, if you do this,
that's a great one,
then this is what happens. And if you don't do this, this is what happens. So you should try to always talk to your patients, doctors out there listening, about the highlighting that from that standpoint. E is for established safety net. There has to be the patients have to feel, and clients have to feel safe and secure, again, that they can disclose and that they're being listened to, and that at the end of the day, they're walking out feeling comfortable about their choices. And then lastly, M is make it easy. Yeah. Keep it simple, silly, or simple, stupid, however you want to say it. I like KISS. I love it from that standpoint. What let them isn't and should never be is abandonment. You can't do whatever you want to do. There has to be some non-negotiables, especially in my line of work, where your safety and your health are concerned.
Well, and they're coming to you, so they need you to give them some direction. It's kind of like kids love structure, and they want us to give them some recommendations. But you have to work with that patient and figure out where they are in their process, and are they ready to hear that and take them. But they don't want us just to say, go off and do whatever you want.
No.
They want us to give them some structure and some guidelines and make them feel safe, just like kids need that. Sometimes kids don't think they need it at any age, but they do. They really do require some structure. And I think our patients need that as well.
Oh, I wish I had let them through when I was raising my children. I really, really do. I'll give choices when I can. I'll make it easy when I can. And I'm certainly going to establish and highlight the trade-offs when I can. But the first and foremost is you have to know I'm in this for you and I'm doing the right thing for you. But I'm not forcing you. I'm reasoning with you, and you're going to be involved in your care. It's not, and the next one is, it's not manipulation. Right. It's not, the choices should be accepted by you, not I have to, okay? And lastly, we shouldn't ignore people who are impaired and can't make their own decisions from that standpoint. So that's not what let them is. So, do you have any nutrition fixes that you would give people involving the let them? I know you gave your 10 steps.
So nutrition fix in what aspect?
Well, in terms of things that they can do right now to take control using that let them theory. Is there anything?
I think something that works a lot for patients is journaling, right? And I tell them all the time to write 3 things they're struggling with and 3 ways they can address it.
That's perfect.
Right? And sometimes they can't come up with 3, and that's okay. I'll say, come back to it. It's sort of like a reverse gratitude journal in a way, but it allows them to put it out on paper and look at it and then think, okay, so if it is that I'm overeating at night, what are 3 ways that I, meaning the patient, can maybe address this? And we'll talk through them often, and sometimes if I'm not there, I'll tell them to do that at home. If they're finding I have clients who have eating disorders also, so if somebody's having a binge, right, they're feeling they want to binge eat, I tell them to journal all their emotions down on paper and then walk themselves through it. So it's kind of like a self-help, step-by-step sort of thing. That's
a good recommendation. From my perspective, it's very simple. And we talked about this in our heart attack show. We talk about this a lot. Know your numbers. You have to know your numbers. Take control of your life. Make sure that your doctor is ordering the right tests. I talk a lot about coronary calcium scores on our heart attack show. If you ever get a chance, go back and look at that show, The Heart Attack You Never See Coming. Know your blood pressure. When we tell you to take your blood pressure at home and monitor your blood pressure, most of my patients bring in logs. They're really good about this, and I support them and acknowledge the fact that they're doing that, but not everybody. And it takes me sometimes because they don't change until they're ready. And now their blood pressure is still high, and their blood pressure is still high. And it's like, when are you going to make the decision to check this on a regular basis? Know your numbers from your metabolism, your metabolic numbers, your sugar and your cholesterol, the good cholesterol, the bad cholesterol, the triglycerides, your insulin levels. All of those things should be that you should track those regularly and be responsible. Don't wait for symptoms, okay? This is the big one. I always say, get to it before it gets to you. That's one of my big, for the past 29 years, I've always used that with my patients. And then lastly, you like progress over perfection. I like prevention pays over procrastination.
That's a great one too.
Okay?
It really is.
So that's utilizing the let them theory to the way we would see it in healthcare.
Yeah.
Okay? To prevent and live a long, healthy life.
We're just your guide, right? We're here to send you in the right direction and help you create the best life, right? To be your healthiest version of yourself.
Well, again, let them allows you to choose the path. You're in control, and you're more likely to stay on a safer path if you use this type of approach.
Absolutely.
There's a great quote: life is hard, choose your heart. Okay?
Yes.
So again, please, we'd love you to like this show. We'd love you to pass it on to your friends and family, because I think it's a great aspect that that Mel Robbins has created, and that now we can utilize it in your healthcare and your longevity. And subscribe to our channel to get news about further podcasts as they're coming about. And remember, if you keep doing the things that you always do, you're going to get what you always get.
That's true. And the life and health that you desire
is the life and health that you're avoiding.
Absolutely.
So together, let's get to work.
Hi, I'm Philippa Beddington, registered dietitian and integrative wellness specialist, and I am the creator of Phil Knows Food and the author of Cracking the Food Code.
Hi, I'm Dr. Scott. I've spent 30 years in the cardiac cath lab, and I am sick and tired of seeing preventable diseases not prevented.